Hello, beautiful people. Hope everybody doing well. So today's session was actually scheduled with one of my expert doctor, but unfortunately he is unavailable today for today's session. So I thought, okay, uh, although I am going to reschedule that with my doctor because this is a such kind of very important topic, in regards for health and strokes. So definitely I'm going to reschedule that, but it's sort of a kind of layman language, you can say that, or maybe like for general awareness. I thought I should really talk on this, and for that matter I prepared one sort of a kind of a presentation as well, so which I'm also going to share that with my audience. So give me a moment, and today's session would be a kind of very short session because for that, like for this particular topic, definitely, I'm going to come back with my expert doctor. So if I say, I hope my presentation is, yeah, it is here on the screen. I believe people, they can see that. So, for general understanding, if I say for heart attack, actually, what is a heart attack? Heart attack actually occurs when blood flow to the heart is blocked, typically by a blood clot, you can say, or sort of, kind of leading to damage of the heart muscle. And if I'd say for my second slide, I believe that, I put it particular for kind of common heart attack, or can say warning signs, or maybe you can say in other language like common symptoms. What would be that? So we can say, of course, like for chest pain, shortness of breath, that could be nausea, sweating, and kind of pain in the arm, neck, or jaw. If I would say more about it, like, what causes a kind of heart attack. So that, like, maybe sort of, I'd say, caused by coronary artery disease, or where arteries are narrowed due to, kind of plaque buildup. Then when I'd say sort of kind of medical term for a heart attack, it's kind of myocardial infection, which is, MI. For diagnosis, if I'd say, through symptoms, that is, we know it, that term, which we call it ECG, electrocardiogram, and blood test, measuring cardiac enzymes. For that, like, patient, they could go and can go for a sort of, test of heart attack, something happened, or, any kind of problem or issue with that. Now, if I'd say for heart attack treatment, uh, as again, like, there's one uh, tablet or medicine being recommended. I'm not really sure. Otherwise, I had to ask from my doctor that should we take this name or not. But yeah, there is one medicine which is like, that is aspirin, and normally, being given to patients, in regard for this sort of issue, for like, heart attack or something. Angina, that is also sort of, I'd say, kind of chest pain, which is caused by reduced blood flow to the heart, often a kind of warning sign. Actually, it's not a kind of heart attack, but again, could be a sign of warning that, yeah, maybe you can have a kind of potential for heart attack. So that is, you can say, alarming sort of situation when people, they would have sort of, angina attack or something. And a lot more people, they have a sort of, kind of understanding in the sense that maybe, if they would have a kind of family history, or sort of, hereditary, meaning like, having it or coming up from their, family side about, heart attacks. So of course, family history actually can increase the risk, But if you're going to improve your lifestyle factors, also meaning like, that could be a main lifestyle as a factor. If somebody or people, they're coming, keeping that in their mind, that okay, if they are improving their lifestyle, so definitely, it could play a significant role. So that was about sort of, kind of heart attack kind of thing. I'm going to change my slide because that was one very beautiful slide. So let me check if I can get that one, which was about, I did talk about this. I'm going to come back later for the strokes because my slides, I think they just, mixed up. I'm going to check one for a beautiful, this one. How can we keep our heart healthy? So if you just see all these sort of kind of small pictures around that, definitely it has a lot more good things being included, like healthy diet, your good exercise, sort of what else, like no smoking as well, meaning like a lot more people, especially males, for them, like if they smoke, so that could be also have a kind of like very bad factor, or could have bad impact on people's health and or heart health. And they could go towards the heart health, heart attack risk. So that was the thing, where smoking also could damage blood vessels, and of course that could increase kind of plate buildup and clot formation. So that was the thing about it. And eat healthy, reduce sort of salt intake as well, because I feel that whenever we increase salt intake in our diet, so that could be a higher risk for our heart attacks, and of course go towards that side. So more of a healthy thing I can also include afterwards. But if I'd say, and for changing my slide here, because I also wanted to discuss about surgery, I can go further later, but I wanted to discuss about strokes as well. uh, for strokes. Okay. If I just say, if there are sort of different types of strokes. One is like ischemic kind of stroke, which is a sort of caused by clot, meaning there would be a kind of blood clot. And the other one is hemorrhagic, which is a caused by kind of bleeding. So for these sort of strokes, definitely we would discuss that in detail when I would have my doctor, in the room. So for now, yeah, these are two types. There's another type also, but I didn't get more information in that regard. So definitely I'm going to discuss that with my doctor. So if some sort of like, common symptoms, if I just say, and I didn't change the slide, let me check for that symptom also. Not this one. Yeah, this one as well, where we say that, yeah, if that is a kind of indication, it's we call like a acronym, like fast we call it. And in that, like if people they're seeing that their face is drooping, or having their arm weakness, or meaning like some sort of they would have weak arms, or there would be a problem of speech difficulty, meaning like they won't be able to speak or talk. So yeah, definitely that would be a sort of kind of alarming situation, where they would have these sort of problems. And some other symptoms, as I've just covered a lot in it, but like sudden numbness, a kind of confusion, people they won't be feeling well or comfortable, as I mentioned that, of course, for trouble speaking. So these were the things where I also mentioned about as a kind of symptoms. How could this stroke can be treated? Like, say, for example, for ischemic strokes, they are treated with like dissolving drugs. While if I just say for hemorrhagic stroke, may require kind of surgery. Uh, can high blood pressure cause a stroke? Yes, high blood pressure, of course, is a sort of leading cause of stroke. So that when people they think about it, that yeah, a lot more people they are unable to keep their high blood pressure in control. I mean, they cannot keep their high blood pressure in control. So definitely they can have a sort of issue, for maybe can have the sort of attack of stroke. So yeah, there is a possibility. uh, how could if I talk about the diagnosis of strokes, normally people they go for a kind of CT scan or MRI for evaluating sort of symptoms. And again, like if in general, as I mentioned, like numbness or sort of pain or weakness of arm, or supposedly like that was a kind of thing, like when they would have a kind of problem in their jaw side. So of course people they can have those sort of symptoms, and of course kind of alarming situation, can go to the doctor. uh, Strokes prevention, if I just say, for stroke prevention is something, uh, as again, like for managing your blood pressure and changing your lifestyle. There is one slide I also shared, or not yet. Let me check this one, which is as again, like not only for a heart attack, but for strokes as well. Meaning, like if you are changing your lifestyle, so definitely it's gonna be helpful for all sort of disease. You're gonna be prevented from rather heart attack, or rather like stroke also. So like healthy diet. First of all, like if you're including sort of vegetables, fruits in your diet, so definitely gonna be good for both sides, like rather for strokes and of course for your heart attack. Depression, mental stress, if people they would have, so definitely it's going to affect on their sort of maybe a kind of high risk for their heart attack also. Exercise is important, as if in general I would say, like which way that you could prevent yourself from very major diseases, then you definitely include exercise in your lifestyle. And if you would be able to manage with your sort of stress or depression, so definitely you can be you would be safe from both sides, rather any kind of other problem. And as well as again, like for major problem or issue, which is a sort of heart attack. So definitely, and there's another thing, normally I've heard from doctor, so you should go for a regular checkup as well, like after 3 months, or been suggested from doctors that at least after 3 months you should go for a regular checkup. So for, or and other things, like go for proper sort of kind of test as well, where one test is important, that is the lipid test. So lipid test is also important if you're just gonna go for that. So definitely you would be in check that yeah, if you're having any problem or any issue, so that would also be like earlier being diagnosed, or earlier being resolved. So this was the thing. You need to control your diabetes as well, because your if people who are diabetic, uh, being diabetic, could damage the blood vessels and increasing cardiovascular risk as well. If you can include, because I do say a lot more other times about omega-3, fatty acid inclusion. It is very beneficial, and it reduces triglyceride and inflammation, supporting your heart health as well, and of course, like for other issues. And I mentioned that before, like for if you are reducing intake of salt, so definitely it's going to be helpful. uh, Smoking, people they should quit, or not quit, of course, but it is very difficult, because I've heard that smoking can't just be quit instantly. You have to go step by step. So of course you can discuss that with your doctors for quitting your smoking. And because my brother, I think few weeks ago, he been also um, he been to doctor was just mentioning about like his condition, and just maybe like in regards for health issue and something, and he was asking for quitting cigarettes or smoking. So his doctor suggested that if you are maybe you're having 10 cigarettes in a day, so make it to half, and go up to like 5 cigarettes, so make it the consumption of smoking. So definitely it would be helpful. And of course there would a stage come that maybe you would not even like it. A lot more people, they give the suggestion of vape, but I didn't get information in regards for vape, so I can't say anything for vape. But yeah, definitely when I'd gather more information that way, so definitely can talk on that, because a lot more people, they look for alternatives. I suppose they if they're quitting cigarettes, so they switch on to vape also. I'm not really sure, but yeah, they can directly go and take some suggestions from doctor, from their family doctor or GP. Last slide I would like to talk on, and after that, probably because I am a little bit uncomfortable. The thing is, because my doctor is not available today, because of prepared questions, I was not really sure that, yeah, I'm going to give more detail in that way. But yeah, that happens sometimes, because sometimes when you do not find your doctor, near to you, so then. Uh, Maybe won't be kind of more beneficial, because a lot more people, they will just raise questions that why is it that you talking on it. But yeah, definitely as a kind of general awareness, we can definitely talk on it. And the podcasting actually is for this reason, that we can spread sort of awareness for our audience, or maybe like for our followers. There was last slide about surgeries. Heart surgeries, as again, like some sort of different kind of surgeries are for a kind of, you can say, solution, such as bypass surgery, and or like you can say valve repair. There is also sort of like coronary artery bypass grafting as well, which is a surgery that improves blood flow to the heart by bypassing blocked arteries. Then there is another kind of surgery, which is we call like angioplasty, a minimally invasive procedure to open kind of blocked arteries using a balloon, or you can say like or stent. There is another way of kind of heart valve replacement, which is a sort of kind of replacing a damaged valve with a mechanical or biological valve. So that is also sort of a kind of thingy. Minimally invasive heart surgery, if I just gonna say that surgery, done through some sort of small incisions, and which could reduce a sort of recovery time, meaning like those kind of long procedure surgeries. There are minimally invasive heart surgeries as well, which could take lesser time to to recover for patients. So that is also another thing. I think I pretty much covered for surgeries as well, but one or two things which is a kind of information I can talk here on, because I remember one parent was asking for children surgery. So yeah, there are a lot more children's surgery as well, heart surgeries. That is congenital heart defects, or can say for corrected that heart defect. So those children can also go for surgery. I've also heard long ago about in my family, a child got a hole in his heart. Of course, definitely there was no other solution rather than a surgery. So he did have to go for a surgery. And after that, a lot more people, actually parents, they ask for a sort of, after surgery, take care. So it was also very kind of sensitive sort of condition, where parents will have to be very much careful rather for holding their babies, which way should they hold the babies, which way should they give their babies a bath, which way should they sort of like give them a proper diet, light diet. So yeah, holding their babies is very much important, because of after surgery a child would be very weak or sensitive. So then yeah, he should be in a kind of proper sort of care, in the family as well. And I've also heard that after 2 weeks of surgery, maybe a child would be suffering with sort of like fever. So yeah, that is also kind of symptom that after surgery, in that condition child would have. So that is the thing also. Then there is another, because we are living in technological world, where now this is also kind of good for information for me as well, where surgery can be done through uh, robotic assisting, meaning like doctors or surgeons, with the help of robots, they will be doing their surgery, meaning now our technology is very much advanced, that yeah, surgeries can be happened or can be done that way also. So I think that is all for now, because my slides are also over finished. And for that, actually, I proper prepared that, yeah, today's interview or discussion could go with a proper through channel with a proper structured way. But yeah, sometimes that happens. But never mind, I'm going to come back again with my doctor, and, we can discuss this proper topic in more detail, because I feel like that, yeah, that essence is still missing, and I don't want to take it like for a longer period of time, because I want my doctor to, be in the room to discuss, in proper way. So that way I can also take some breaks as well. But thank you so much for today's session to view, to watch, and hopefully, inshallah, I'm coming back soon for this particular topic. Until you take good care of yourselves, and see you soon. Bye bye.